A fine needle aspirate is actually, it's very straightforward to do, and it's very valuable, and in many circumstances it will be diagnostic and more representative of the area you're interested in. If you have a peripheral lesion, then you may well be able to find it with your ultrasound, do an ultrasound guided fine needle aspirate. If not, then you need to use your nice well-positioned x-rays to identify the anatomic structures, count the ribs, look at where it is, and guide yourself to the site that way. But with a lesion as an area of interest, shall we say, as sizable as that, you've got a reasonable area to aim at. So general anaesthetic for me, you don't want the cat to move at the wrong moment. That's when you might cause some damage. Quite a fine needle, and you can use your x-rays not only to identify where in the cat you're going, but how deep in you think the lesion is, and therefore what length of needle you need to use. I would use a 5 ml syringe to aspirate. Obviously we're going to clip and clean the site. And as I say, it's certainly, if the lesion is reasonably peripheral, it's well worth doing an ultrasound scan to see if you can see the lesion, because obviously that will help you with your guidance. But depending how experienced you are as an ultrasonographer, and depending where the lesion is, it may not be readily visible on ultrasound. So what I would do, so this is a different x-ray from a different cat. This is obviously focal area here that we're concerned about. Obviously we would take orthogonal views, and that will again give us the full way in. But essentially what we do is here's the cat lying in the same orientation. We've clipped over the area of interest. We've counted the ribs and we've drawn on the cat. We've counted the costochondral junctions and we've drawn on the cat so that we can compare the reality with the x-ray, and that helps to zone us in to this area here, which again is a relatively large area that we're trying to sample. So you're not trying to, you're not giving yourself too hard a task. So clipping and prepping, and you can see by the time you've done your sterile prep, most of your colours have rubbed off, but we've still got enough there to know where we are. Obviously we need to go in between the ribs, and if you're not, if anything, for being in front of a rib, not just behind a rib, because the nerves and blood vessels run behind the ribs. So, but hopefully you can feel a nice bit of muscle, intercostal muscle, and go through that. And then, so with the cat nicely asleep, we can identify where we're going to be and just straight in, hold the barrel of the syringe still. So don't try and do a one-handed technique, because then your needle probably will go up and down. So hold the bevel of the syringe, hold the barrel of the syringe, and just a couple of sharp tugs. And you should still get a vacuum, even though you're in lung, you should still get a vacuum just as you would with any other needle aspirate. So just a couple of sharp tugs, don't keep going and going and going. Just 1, 2, I think I did 3 on that one, but 1 or 2 should be sufficient. And then obviously out you come. And actually it should be, again with the cat well restrained, so that it's not moving and your needle's not flailing around in there. It is a very safe technique, especially if you're going into a solid bit of pathology where there isn't normal aerated lung. But normal lung will cope with a needle going in and out of it, and will seal over. So I know it is a bit scary, but actually it's a very valuable technique. Okay, and then with our precious sample, we need to handle it really, and this applies to all needle aspirates, but obviously the more white knuckling the procedure has been for you to collect it, the more you want to make sure that you don't damage it. And you just need to be aware that we just need to handle these samples incredibly carefully, because it's terribly easy to stretch the cells or pull the cytoplasm off the cells, and they simply cannot be interpreted once that's happened. So real gentle handling. You can see in this example we've just got a tiny little bit of bloody aspirate in the hub of the needle. So obviously we're going to push that onto the slide using a 5 ml syringe. And then if you've got, if it's just a tiny bit of stuff in there, you will need to do this kind of sort of, I'm not going to say squash and spread, but spread it with a flat syringe, so a flat glass slide. So you just literally lay the glass slide on top and let it, you're not pushing, you're just letting it spread through surface tension, and then gently draw this one down in order to smear it out. Okay, so we're just gently pulling that one along, and the bottom slide is going to be the sample slide. The problem with this that you can run into if you've got a reasonable amount of liquid is that, you know, that where they kind of stick and a vacuum forms, and when you try and pull, it just tugs. That will absolutely damage your sample. So if that happens, I'm afraid you need to go in and get another sample. And then what I would do if I've got that problem and that amount of fluid is spread it more like a blood smear. So just use the end of the glass slide to gently stretch it out. And I would always take at least 2 or 3 aspirates from whatever lesion we're looking at. The same applies with the lungs. So don't be afraid to go in again and get another sample. We've done this whole procedure. The owners are paying whatever they're paying us to do it. Let's make sure we get the best samples that we can. And as I say, what you hopefully get is a little tiny smear on your slide.